started. Thanks for joining us today. So we have Emily and Shayna, is that right? So they got the names correct there? Okay.
Shauna, but yeah.
Shauna, okay, great. And Emily, great. Nice to meet you guys. Thanks for joining us today. We did have a little bit more students signed on, but sometimes, things come up, and if it's a nice day, sometimes it doesn't work out that way, but we'll still be nice and intimate here, so it'll be good. But my name's Stephanie Buchkowski. I'm one of the admissions directors at Niagara University in the Enrollment Management Office. And we're just so glad to have you here. We have two wonderful ladies who can give you a lot of feedback on the nursing program, which is a wonderful program. I will start off a little bit just by talking about kind of the admission process and where we stand right now, seeing as it is a very different year. First of all, I hope that your junior year ended up on a good note with everything that happened. It's been kind of very trying time. So we're doing all that we can to try and ease that transition. You're not probably going to be able to have a lot of the things and the process of the college search that most do. But I will say, one way I like to spin it, which I think is very positive, is because of the virtual events like this that we host, which we will have tons more over the time. So please, keep your eyes peeled for that. And we are welcoming visitors back to campus starting August 3rd. So that is huge. We will be having still virtual events, admissions events. We will also be having some in-person Monday through Thursdays at 2 o'clock it will be. So please keep that in mind. If you're looking to make a visit, we'd love to have you here. And we're taking all the necessary precautions that we need to follow all the guidelines. So you'll be very, very safe, so you don't have to worry about that. But we want to bring as much information to you as we can. So that is one of the big upsides to being virtual is you kind of have the opportunity to meet and talk with more faculty and students than probably any other student that has entered into their senior year. You would have to visit campus probably every day for a week to meet the people that you have the ability to meet through all these virtual events. So that is one huge upside to the times that we're kind of in right now. So I just like to just add that as a highlight. I think it's important for you guys to know. So like I mentioned, my name's Stephanie. I'm in the admissions office, but also I'm kind of the liaison with the nursing department. So I work very closely with the ladies that you're going to hear from today. I do a final review of all the nursing applications that do come in. So pretty much every one that does come in, it comes across my desk at some point. And what's really nice, and just in terms of the whole admission process in general, us as counselors really stay on top of your application, are always following up and following through, a lot of communication. So we really stay up to, in loop with everything with that for you guys, which is very important. So in terms of kind of the admission process, I want to give you a little bit of background on that. Nursing for us, because this is obviously strictly geared towards the program that you're interested in, it is our only competitive program that we have on campus. Probably not the first time you'll hear that about nursing programs, as most of them are. But where ours really stands out too is we are a direct entry. So it is not a matter, you have to be very cautious sometimes because you may be accepted to a school but not necessarily accepted into the nursing program. So this is very important for you to know that if you get accepted to the nursing program at Niagara, you are immediately starting as a freshman. You don't have to apply later and wait for a seat. You are directly admitted, which is great. So you're getting in there right away. I'm getting the experience and everything that you need, and just kind of learning everything right off the bat, which is nice. And they will certainly talk about that whole curriculum and that too, way better than I can. So now with seeing as the times are a little bit different, given with the pandemic and everything, especially with SAT scores and ACTs, since we do only have a couple of you on, it makes it, like I said, it's nice to be personal. Would you guys mind sharing if you have been able to take the PSAT or the SAT or /ACT? Have you guys been able to take that?
I have not been able to take either of them because of everything that's happened. So.
Okay, and no PSAT either?
I haven't taken the PSAT, but I have a date for the SAT in September.
Okay, great. Okay, excellent. And how about you, Shauna?
I have been able to take my PSAT, but none of the ACT or ACT yet.
Okay. Pretty much going to be the norm right now, I'm guessing, for all the students that are coming in. So some different guidelines that we're going to kind of put into place, because clearly this is not something that is anyone's fault. Nursing, we are a test optional university, except for biology and nursing. now we obviously have to kind of have some different guidelines in terms of and how we review the nursing applications if you haven't been able to take it. If we are able to get your scores, you know, but say whenever you decide to apply, if we do get those scores, and we will certainly use them. And if you would rather us wait for them, we certainly can too. We do work on a rolling basis where when we get your application, it only takes us roughly about maybe 3 to 4 weeks to know if you've been accepted. And that's even kind of pushing it. So we don't really wait too long. It's not really much of a waiting game for us. So with rolling, that technically means in every way. We're rolling with admissions. We're rolling with like deposit time, and that's a lot. I know a lot of it's on the road for you, but just keep in mind, we have no real harsh guidelines when it comes to that kind of thing. So now, so being that it was competitive, we did require the SATs for the nursing program. What we are considering doing in terms of review is looking at what your PSAT score is. Generally and historically, when students have taken the PSAT, they generally are within about a 20 or a 40 point range. So we're thinking of as that just being a guide of how we look at how you would do on the SAT. So we'll probably add like maybe 20 points onto what your PSAT score was, and kind of gives us an idea of where you may have fallen with that. But like I said, you know, it's no problem if you were taking the SAT. If you want to wait for the scores, you can certainly do that. And you know, I believe the ACT was offered in July, so those may have more offerings for you if you're considering that route, because we'll take either one. So with that being said, then with average and things like that, so we will look at your cumulative average from the end of your junior year. Okay. General admission, we like to see about 85. For nursing, it's about 90 to 92, roughly, we like to see for that, okay? Sciences are very important. You guys look at the math, the science, like health, bio, chemistry, very important as well, like your core classes. So those are things too, just you wanna keep in mind when doing the application. Those are ideal, that's an ideal candidate. We have a very holistic review of all the applications that come in. So if you do not have a 90 or 92 or something like that, or your SAT does not fall, which roughly for SAT we like to see like maybe around 1100 or so, that does not mean don't apply. We take everything into consideration. This is the time to sell yourself, okay? All of the things that you have been involved in, any kind of experience that you have, whether it be in school, out of school, whatever your high school career, this is a time to like make yourself shine. And we read your, essay is very important. If you can talk about maybe why you're interested in nursing, what has, kind of sparked that in you. Letters of recommendation, maybe from, chemistry teacher, science teacher, something along those lines. If you're in anything like a New Visions, like a pre-nursing type of program, all of those things are taken into consideration when we look at a nursing applicant. So is not that cut and dry in terms of the grades, especially now, given what students have been going through. It's not time to like have a real hard line. So just keep all that in mind and don't let it scare you, certainly, just because it is competitive. So this year, we did offer about 90 seats. We processed about 600 applications. So it kind of gives you an idea of the competitiveness of it. So we do recommend that you apply early if you can. It's probably just in your best interest if you can. In terms of the application, we are a member of the Common App, okay? And then we do have our own personal application on our website as well. Both are free to apply. Whatever you choose is completely up to you, whatever you feel most comfortable with. Every student is assigned a specific counselor in our office. So you will have an admissions advisor or a counselor that will be the one that actually reads your application. For nursing in particular, though, the counselor will originally read it, but then pass it on to myself. And then if need be, I will also go to the nursing department just to kind of talk over maybe some things that way too, in terms of offering the acceptance. So that's kind of how the timeline works. Another thing, lastly, which I think is important in terms of the admission side of things that is good for you to know, is because we are a private school, we will offer you automatic merit scholarship money. Merit money is simply based on you and what you've done. Okay, so we take your average, and if you are submitting your SAT scores and that, we look everything take into consideration. But for this year, What happens is as soon as we get your application and you were to receive an acceptance, we figure out this merit scholarship for you right away. So if you were to get an acceptance letter, it goes right out with your acceptance letter as well. So there's no waiting game on that either. So for this year, they started at $10,000 and went all the way up to $23,000 a year. So that's guaranteed money all 4 years. And like I said, there's no waiting game with that either. So you get that automatic merit money. Nothing to do with financial aid or any kind of grant money or anything like that that you may receive. It's strictly just based on you and what you've done. So obviously, of course, the higher the grade and possible SAT, the more money you would receive. But we definitely, our goal is to keep Niagara affordable for you. That's one of the most important things. So it's certainly, really show your kind of demonstrated interest to us with attending events, talking with your counselor one-on-one, just kind of staying engaged. It's very important too when it comes to different things like that. So, but any admission type questions quickly that you could think of right now? We do have a chat box that if while the other ladies are speaking, if something pops up, please do that and I will answer it in the chat box for you. But other than that, if we're ready to move on, I can kind of turn things over to Maria.
Hi, I'm Dr. Firslina Godowski. I'm one of the professors at Niagara University in the School of Nursing. I'm actually a graduate of Niagara University. I have my bachelor's in biology and my bachelor's in nursing, which I earned both of those from Niagara University. I am a family nurse practitioner and I also have my doctorate. So that gives you a little bit about myself and who would be teaching some of your classes, so you know my credentials. As Stephanie said, in the School of Nursing, you are admitted right into the School of Nursing. So I know some schools, after 2 years, they look at your grades and then you have to apply. Well, at Niagara, when you apply, you're applying into the School of Nursing. So when you are accepted as a Niagara University nursing student. Now, having said that, it is up to each individual student to stay in the program. So you are accepted in the program, yes, absolutely. So on day one, you are a nursing student. In order to continue being a nursing student and to earn a degree from Niagara University School of Nursing, you definitely need to keep your grades up, okay? So I just want to make sure that, though you are accepted, grades need to, you need to keep your grades up. Pretty much right off the bat, very first semester, fall semester, you'll be taking a course, Foundations. Foundations is just an intro to nursing course. Talks about the kind of like the theory of nursing and talks about nursing theorists and history of nursing and things like that. When you get into you'll also be taking anatomy and physiology. So anatomy and physiology will also go along in that semester along with the lab. So you take A&P1 with the lab, and also a chemistry course. In the second semester of your freshman year, you take Concepts. Concepts is one of the courses that I teach. That is a basic nursing course that teaches how to do vital signs, bed baths, bed making. You learn elimination, bowel elimination, urinary elimination. You learn about diets, just different things like that. PPE, how to put on and take off PPE, how to transfer patients, things like that. Okay, so it's very basic. Along with that, you'd be taking Anatomy and Physiology 2 plus lab, along with microbiology and lab as well. Okay. Usually somewhere within the first or second semester, you're also taking an intro to psychology course, because eventually what you're going to have to do is take developmental psych. Okay. In your sophomore year, fall semester, you would be taking health assessment, which is another course that I teach. Health assessment also has a lab associated with it. In that course, you learn how to examine a patient. So you learn how to examine a patient from head to toe. So you learn your full assessments, your hospital assessment that you're going to use when you go into the hospital in your second semester sophomore year, which would be the spring semester. But quickly going back to the fall semester, while you're taking health assessment, you are also going to be taking pathophysiology. So pathophysiology builds on anatomy and physiology, where anatomy and physiology talks about normal states and the normal function of the body. Pathophysiology talks about disease, okay? Which is very important. As nurses, we have to understand disease, not just how the body functions in a normal state, but of course, how it functions when one is sick. In the spring semester, that is when you do your first clinical. You would be taking Med Surg 1, so medical surgical nursing 1, along with pharmacology. Then in the fall of your junior year, you would be taking Med Surg 2, so medical surgical nursing 2. And with that, you would also be doing a clinical. In your spring semester of your junior year, that is when you do your OB-PEDS. So OB-PEDS is a split semester. So either you're doing OB first and then you go to PEDS, or you do PEDS first and then you go to OB. It just depends. Some students want to do OB first because they like the progression. Other students are just really anxious to be with kids, so they really want to do the PEDS first and then they do the OB. Both of those, whether you do, whichever one you do first, each one of them has a clinical. So clinical is associated with both of those. Your senior year, that is when you have your more clinicals. You'll be doing your community, you'll be doing a leadership. You will also be taking some more psych courses. We have a psych rotation in that fall semester. In the spring semester, that is when you do your internship. So an internship is done in that spring semester. And in that spring semester, when you do your internship, what you're going to be doing is you will be working with a nurse, and you'll be basically having a patient load. So working as a nurse alongside of a nurse, getting you ready to graduate and sitting for your NCLEX, getting ready for all of that. As you are progressing through the program, we do have our testing. When we do give tests, we do give NCLEX style questions. And the reason we do that is so when you sit for your boards, it's not the first time you're ever seeing an NCLEX style question. So you are prepared. Even in my class, concepts, and we do start it basically the first semester of freshman year. So in that fall semester, when you are a freshman, we start just giving you some NCLEX style questions. Right now, what we are using is we're using Kaplan. We use the focused exam and we use the integrated. And that's how we prepare our students for their senior year when they sit for their boards. Okay, so that gives you an indication of how we prepare our students for the boards. I'm trying to think, let's see. You'd be taking statistics. So there's a stats course that you would be taking. That's the math you have to take. You will learn how to calculate, drip rates and things like that, medications. That's all taught within the nursing courses. And basically in concepts is when you start. That second semester is when you start just your basic calculation of medication. As you move on in the program, that's when you learn how to calculate drip rates and all that, okay? But it's just very basic in the beginning. let's see.
Professor, if you wouldn't mind, would you
Yeah.
just talk a little bit about the sim labs a little bit? Would that
Oh,
be okay?
absolutely.
Yeah.
Yes. We also have a sim lab. So our sim lab, we have simulations. Every class, as we're moving forward, we're using our sim lab more and more. We do have a mom that gives birth. So we do have, a pregnant mom that births. So we do have the birthing mom. That is new. We do that. We can run codes. So basically our sim lab professors can, run a simulation, or, when we have faculty who is in charge of that lab, then we just let them know, and we just can run, we'll have them run a simulation. So we can do that. And we also have debriefing. So as students are broken up into groups and they are doing a simulation, there is another group that is watching in the conference room next door, and then they debrief. So when the students who are actually doing the simulation, when they are done, then they all come together and they debrief, and they talk about, what could be different, and how, what approaches can be done, and things like that. We also have practice labs. We have test out labs, and that is actually in our in DePaul Hall, which is another building. And we have full labs with mannequins. We have high fidelity mannequins. We have medium fidelity, low fidelity. So we have all different types of mannequins that you could want to practice on. And we do use those. So when we are doing our test outs, many times we are using mannequins, and for health assessment, we can use them in my course, because those mannequins, they actually have heart sounds, they have lung sounds. So I can test my students on heart sounds and lung sounds just by, using those mannequins. Vital signs, things like that.
Excellent. Great. So Laura, I know you're usually referred to as the mom of the office. Is that accurate? Aren't you? Oh, you're muted.
It's really not accurate. Actually, Dr. Fasini Gadowski is the mom of the group.
Okay.
I'm definitely the easiest person to get to, and I love the students like so much, but I do defer because she is the true mom. Dr. Fasini Gadowski is the coordinator for our traditional program, so any student problems or any student issues, she takes care of those, and she's just delightful, and I know that our students love her, and she's very available to them. So Stephanie told you guys a little bit about the application process and the admissions process. Dr. Fasini Gadowski spoke to you a lot about curriculum and what your experience as a nursing student is going to be like here. I'm going to talk to you about some of the basics. I'm going to kind of talk to you about why Niagara, because I love it here, and I can't say enough about it. So I'm going to tell you a little story, and I probably shouldn't because this is recording, but I'm going to anyway. When I first started working here, and everyone's like so nice all the time, and everyone's like so helpful, and everyone like, hey, I hadn't been here very long, and hey, Laura, hey. I'm just like, okay, when's the bloom going to fall off the rose? When are people going to show their true colors? Okay, I'm going on 5 years, and it's still going on. So they're either really, really good actors, and I've never seen anyone be able to fake anything that long, or it's really true. There is a Vincentian piece that Niagara boasts about and showcases that is legit, and it's real, and it plays ridiculously well into the School of Nursing. So I will say this also about nursing. Nursing is one of the most beautiful professions that I have seen, and I love my nurses. I would do anything for them. There is a reason that I am not one. Okay. Dr. Christina Godowski is talking about bowel things, and I'm just like, ooh. So there's a reason that I'm not one, which is another reason why we kind of sequence our courses the way that we do. As Dr. Christina Godowski mentioned, we have nursing courses your very first semester. That way students get an idea, you know, is this really what I thought it was going to be? Because it seems so beautiful and angelic until I get into a situation where something smells really bad and I have to touch it. Okay. Deal breaker. So we try to get our students out there and get some experience as soon as possible. So if it's not a good fit, they're not losing a lot of time and money and effort on something that might not be for them. So that's another reason for me why I think Niagara is just a great choice. Going back to that Vincentian piece, that is threaded throughout our curriculum. It's not just patient ABC, disease ABC, these symptoms, this. It's the whole picture. This is this patient's family, and this is this patient's situation, and this is this patient's life. And it's threaded throughout so that our nurses really do, when they come out, have that big picture knowledge of nursing. And honestly, in this area, Niagara nurses are sought after for that. They have that heart for nursing as opposed to just the clinical side. You definitely get the clinical side here as well, but you do get that Vincentian piece. So to me, that's a big plus for why Niagara. That's one of those things that sets us apart. Another thing that sets us apart, you can't see that I'm pointing to her, but Dr. Christina Godowski, our faculty set us apart. They're very wonderful in working with our students. They're very wonderful in
We have a new person joining us. Quick, just a new person coming in right now.
Oh, okay.
Wanted to let you know. Yep.
Okay, great. Okay, hi Alexa.
Hi, Alexa.
All right, I'm just going to keep going. So another big reason is our faculty. Our faculty are available to students and willing to help. There are programs out there, which we are not one, but there are programs out there that may see students struggling and at that point realize, oh my goodness, this student is struggling academically, so they may not pass the boards the very first time they take them. So, you know, we're gonna kind of weed them out because we don't want them to affect our board scores. Niagara, again, it's that Vincentian piece. As Dr. Christina Godowski said, you do have a seat in the nursing program from the very beginning. You have to keep it. Okay, but we help you to the best of our ability to keep that seat. We have great resources in the academic success office for tutoring and academic support. We have a counseling center here. Dr. Christina Godowski is definitely the mom of the group, but I'm the easiest one to get to. So I truly take the students very seriously. They're my favorite part of my job. There's a lot of parts of my job that I could leave, but I could never leave the students. I will fight tooth and nail to get students the resources that they need. That being said, you as nursing students are going to learn to be an advocate for your patients while you're in nursing school, no matter where you go, even though it should be here. No matter where you go, you need to be an advocate for yourself, okay? So if you're struggling, you need to reach out to someone. I can get a student any resource they need. I can't get them anything if I don't know they need it, okay? So be sure you're aware of that as you move forward in this journey of deciding where you're gonna go. Make sure you ask those questions. Make sure you advocate for yourself throughout your whole 4 years as a nursing student. There's a couple things you should be aware of. Nursing curriculum, Dr. Christina Godowski just went over it with you. The curriculum's pretty tight. Most of your classes are required. Ooh, I gotta talk to you about that too. Most of your classes are required, so there's not a lot of wiggle room for extras like minors or study abroads or those kind of things. We can do them. You need to be proactive on your part, okay? Again, we can get you whatever resources you need, but we need to know as soon as possible so we can make arrangements for those. So you guys are going into your senior year, correct? Give me a thumbs up. Yes, yes. Okay. if you're taking AP classes, if you're taking college classes, if you're doing things like that to bring credits in, and you want to know, hey, I wonder if this will apply to what I'm going to need at Niagara. If you have any questions like that along the way, my name is Laura. I'm the office coordinator. I'm on the website, super easy to get in touch with. If I don't know the answer, I know who does, okay? So if you're thinking, hey, I could either take psych or I could take calculus, and you want to reach out to me, then I'm definitely going to tell you to take psych because you need psych, and calculus, not so much. So if you want to reach out to me with those questions, I would be really happy to guide you in that way. It breaks my heart that, and even this year, I have students who are bringing in a plethora of credits, and we just have nowhere to place them on the curriculum cards. So some of them are lost. So if you need help with that, by all means, reach out. I talked to you about that. I talked to you about weeding out our students. I do want to talk to you a little bit about our clinical rotations. Dr. Christina Godowski hit it. So what clinical rotations are is they're associated with a class. So med surg, OB peds, community health. That is 1 day a week spent in a healthcare agency. It might be a hospital, it might be a clinic, it might be who knows where, but you're spending 1 day a week in that setting. The wonderful thing about our clinical rotations, which is another reason why Niagara, the other good thing about that is that you get a chance to see all those hospitals, and you get a chance to see, hey, I really like how this hospital system works, but this I'm not so sure about, or, you know, ECMC really did this great and Buff Gen really did this great. So you get to kind of interview those hospitals. And the beauty of it is that you're making connections there while you're there. So when it's time for you to graduate and apply to schools, you've already kind of worked in their system, and they can go to their nurses and say, hey, did you work with these students? And they can say, yes, we did. So at the very end of our program, you'll do a full-on internship at one of these hospitals. By that time, you usually have an idea of what kind of nursing you want to go in. Do I want to do med surg? Do I want to do peds? Do I want to do this? I'm not going to lie to you and say every single time we're able to place students in their area of interest, but a lot of times we are, and those are like working interviews. A really, really high percentage of our students have jobs on the table before they graduate college because of those internships. So it's just a really great opportunity within healthcare system to look at different hospitals and let them take a look at you. So just another why Niagara, because we're great. So I can't think of anything else. If you have any questions along, like now, of course, we have time for, we do have time, right? We have time for some questions and answers now. But again, my address is on the website. If I don't know, I can get you to who does. And honestly, again, it's my favorite part of my job, so bring it on. Okay.
I love it. I'll tell you that working with these ladies in this with the department is just, the passion is unbelievable. And I always say it makes me want to go back to school to be a nurse, I swear. And one thing I have to say is, in myself, I mean, I've been at Niagara for 19 years, really long time, and I've traveled pretty much everywhere on behalf of the university. You know, I'm talking with students about different programs. I have to tell you, the nursing alum they will seek me out at events. They will come out to talk to me about their experience, how much they love being a Niagara nurse, and the experience that they had. They just have the most wonderful things to say about it. And this is from, you know, students and nurses that graduated years and years and years ago. And it's really stuck with them. I think that says so much as well. The kind of program, it just continues on. I swear, it really just keeps getting better. So it's great. So I did have a question actually in the chat box, which is nice. Someone had asked, Alexa had asked about some schools, because we decide, you know, promptly with accepting the, you know, once these students submit their application, how quickly we make the decision, which Alexa, I knew because you came in a little bit late. We do work on a rolling basis with the nursing applications. So we do recommend applying early, and we let you know as long as we do have everything within about 3 to 4 weeks if you've been accepted. So we move fairly quickly. But she had also asked, would it affect honors and like some of the more competitive programs? And no, there's still a timeline. It would have no effect on that whatsoever. So you'd still have the opportunity to do any of those things if you wanted to, and are getting into those honors programs for sure. And since we have spoken, now, Emily, I feel like I met you.
Yeah,
Am I right?
I did one of the other like virtual sessions. Like,
Oh, okay. I remember you. Yeah, I totally remember you. I was like, I thought you looked familiar. But can anyone think of some questions right now at all? Because especially, you know, kind of heard a lot of great information, but is there anything in particular that you want to know about? Even maybe about campus itself, maybe not necessarily nursing, you know, geared towards nursing, but anything about the campus, anything like that that you can think of? Are you guys looking to, once schools start kind of opening up again, are you thinking to make some in-person visits to the schools that you're looking at?
I made a visit for August 12th to.
Oh, great. Okay.
Yeah.
Now, what day of the week is that? Is it a Wednesday, maybe?
Wednesday?
It's
Wednesday?
let's see.
It's not a Saturday day, no. Okay. Okay, good. Oh, great. Well, we will be so happy to have you. And, you know, like I said, I want to kind of repeat myself, and I don't want Alexa to miss out on anything. We have brought back in-person visits starting next week. So if you'd like to come, you know, visit campus, we'd love to have you. We are being very, very cautious and have all the proper safety measures in place with everything that we need for the state guidelines. So please, if you're looking to do that, we'd love to have you. You can register for any of them online. And we, like I said, we'll be hosting many virtual events. What is really something that's become a good thing out of all of this that I also failed to mention before is now we have a hybrid way of talking and engaging with our students. It's not just now you have to come to campus. I mean, now you have so many options where you can do just general admissions virtual, or you can come to campus, or you can, you know, do very like this major specific, all that kind of stuff. And like the events that we're putting on right now, virtual events for our students that are looking to move on to campus for this fall, there's just been a plethora of them because there's just so many questions out there. We're doing everything we can to make sure we field those properly and that students feel comfortable, you know, moving onto campus when that time comes. But whether it be another open house you possibly are able to attend, I mean, I'm sure the bigger events will probably take a little bit longer for us to host. But, you know, we'll have an open house on August 15th. It's a virtual open house. A good amount of students are signed up right now, so I'd recommend maybe that. You hear a lot of great why Niagara, a lot about from different, you know, current students, which I always think it's so important for you to hear from current students. All those kinds of sides of everything. So if you can, you know, attend some of those, I would highly recommend it for sure. Anything else? Any little tidbits you ladies like to add, or can you think of any other questions that you guys have? Oh, I have a question. Does it matter which program we apply for, whether it be competitive or not, as long as it's in the date specified, for example, nursing? Yes, so even though the program is considered a competitive program, we don't have a deadline for the application. However, if you've been accepted, we do have a nursing cutoff letter. So for example, this past year, we processed about 600 applications and we offered 90 seats. So if you have not made the decision and we're getting close to being full, we will send you a letter letting you know roughly about a month out, you know, that we're getting close to capacity, and for you to please let us know if you're going to be attending. And then, you know, if we don't hear, you know, sometimes really some people, you know, just depends. Sometimes they will deposit because many nursing programs are competitive. They may deposit at other schools as well. So, you know, things can certainly happen. And then basically a wait list forms that I also manage. And then I work off of the wait list for any students that, you know, might be able to get in at that point. But with that being said, you know, like I said, so we're constantly accepting the applications as we get them. So you don't have to worry about that. But even still, I do highly recommend applying early. Ideally, I would keep between Halloween and Thanksgiving in the back of your mind. That would be kind of a good range to keep in the back of your head. That is when we get the most and the bulk of our applications is right after Thanksgiving break. So if you're able to get things in sooner, you know, that'd be great. And as for the SAT and ACT, because I know not to be repetitive, just so she doesn't kind of miss out on that. If you weren't able to take your SAT or ACT, we are looking at some different guidelines of what we are looking for acceptance. General requirements is roughly about 1,100 and above, and about 92 overall average. But it is a very holistic review of the application. We take everything into consideration, from experience, letters of recommendation, essay. Your core classes are very important to all of those things. So those are some certainly things to keep in mind as you're sending in your application. Anything else? Feel pretty clear, pretty good? Good. Okay. Well, it was a pleasure having you guys on today. And ladies, you're always wonderful. Thank you for all the great information. It kind of gives you an idea of the kind of atmosphere that you'd be, getting into, and with them for sure. Like I mentioned, my name's Stephanie, one of the admissions directors here in the office and the nursing liaison. So like I said, I will be the final read on your application for nursing. So if you have any specific questions, please don't hesitate to reach out to me. Very easy to find on the website, and actually put my information in the chat box here. Actually, ladies, if you wouldn't mind, maybe Laura, just because you're kind of the main, like a big point of contact, would you mind just typing in, putting in like your email address in the chat box so they have, in case they have any questions? Thank you. That'd be awesome. And I'll put in my name in too. I'm directly through admissions, but you can, reach out to either one of us. If I can spell my own name right. It's a long one. Okay, there we go. So you guys have that. If you have any questions, you can certainly do that. Perfect. All right, great. Well, I hope to see you on some more events. And certainly, Emily, we'll welcome you. Can't wait to have you on campus. And the other two ladies while you're here, if you please schedule a visit to come see us if you want. We'd love to have you. So we miss you very much, seeing students on campus.
I miss the energy of the young.
Yes.
So, I miss the students being on campus. So if you're on campus for a tour, even if it doesn't include nursing, when you go through Dunleavy Hall, my office is right there. So pop your head in, say hi.
Mm-hmm.
Okay?
Definitely do that. Great. All right, everyone. Well, thank you so much. Have a wonderful evening. Stay safe and just stay in touch and engage with us. And we look forward to seeing you and working with you in the fall.
Thank you.
Bye, everyone. Thank you.